Welcome back to our second Let's Talk Health podcast. We are glad that you have decided to join us again. My wife is unable to be with us on today, but we do have our guest with us, Dr. Monique Balthazar. And we're still dealing with the topic of socioeconomic disadvantages in the healthcare system, but this time we are focusing on the HIV and HIV/AIDS community. Dr. Balthazar, welcome and thank you for being with us on today. Can you go ahead and introduce yourself to our audience?
Hi, thank you for having me. Like you said, Dr. Monique Balthazar. I am presently working as a postdoctoral fellow and clinical instructor at Emory University. But in August, I'm transitioning over to Georgia State University, where I'll be an assistant professor out of the School of Nursing. So looking forward to that transition. I am also a certified nurse practitioner and worked in the primary care setting for a number of years prior to stepping into academia.
Oh, good. So, another well-educated Black woman. We're definitely glad again to have you with us on today. So we're going to go ahead and get started with our questions that we have for you. Again, we're dealing with the socioeconomic disadvantages in the healthcare system, but we're dealing more specifically with the HIV and AIDS community. Dr. Balthazar, you did a dissertation, I think it is, titled The Impact of Population Characteristic and Health Behaviors on the Immunologic Function of People Living with HIV/AIDS in a Midwestern city. Can you explain your study to us and what you found?
Yeah, so in essence, I wanted to take a number of socioeconomic, psychosocial factors that we know impact health overall and see how those factors explained differences in health outcomes for people living with HIV. And so my health outcomes of interest in my study were HIV viral load and CD4 count. So CD4 count is a measure of the immune system for people living with HIV, and then HIV viral load tells us how much of the virus is living in the system. My work ultimately, what emerged up from my work is that sleep is a really, really important factor in health outcomes for people living with HIV, and it's very understudied. So right now, my focus is in sleep health, understanding sleep health in people living with HIV and trying to improve that with the ultimate goal of improving overall health outcomes.
Okay, well, good. So we just wanted you to give you an opportunity to explain your let everyone know, should I say, that you have done a study with the HIV/AIDS community and everything, and you can't speak on this topic, and we're definitely glad that you're on here with that expertise for this topic. So research says that socioeconomic status negatively impact the population of those with HIV and AIDS. What have you found to be the association between socioeconomic status and the HIV/AIDS community?
So yes, that's true. So socioeconomic status impacts all levels of our lives. And so there is a way in which research and biomedical research specifically, we have a way of presenting research as if it is a race issue. So we are splitting things up based off of a racial category. We know, as in the scientific community, we know that biologically there are no differences between the races. In fact, there are greater differences within a racial category or between racial categories than there are within them. So, and those differences are still less than 1%. So biologically, we're the same. So when we are having conversations, the problem with having conversations around race, when we say, well, Black people are at greater risk for HIV, it puts the onus of responsibility on the color of your skin instead of the actual underlying issue. And the actual underlying issue is socioeconomics. So, and that is to say that a community of individuals who makes $10,000 a year have different health experiences than a community of people who make $100,000 a year. The color of your skin isn't the underlying factor there. The underlying factor there are the resources at your hands. Because of historic and ongoing systemic racism, we are finding that more people of color tend to fall into the category of people who have less resources versus white people. And so anyway, I wanted to start there because a lot of this conversation is going to end up looking very race, like there are a lot of big race differences, but there was actually a fairly large study recently done that compared poverty communities in urban areas around the United States. And so I'm going to back up a little bit. There are a couple of groups of people who are at higher risk for HIV than the general population. So those groups are people who use IV drugs, men who have sex with men, commercial sex workers, and then those who are commercial sex worker clientele. Those groups of people are at higher risk than the average population. So for this particular study, they removed those higher risk groups and compared the risk for HIV among the individuals living in these impoverished areas in urban settings across the United States. And when you looked at it that way, there are no significant differences between races. But when you step back, you will find that in an impoverished community, I think only 10% of the United States is white if living in an impoverished society or community in the United States. So it's like 45% Black and 45% Hispanic and maybe about 10% white. So the issue, though, isn't the color of your skin. The issue are the resources at your hands. One of the bigger things there, too, is, and so there are, that plays out in a number of different ways. So one, access to healthcare in the first place. Are you even insured? Is there a healthcare clinic in your vicinity? Do you have a transportation to get there? Can you afford medications? Can you even take time off of work to go see your healthcare provider if you need to? There are layers of barriers to people who are living in lower resourced areas because of that. Just by virtue of the fact that they are the way the system is designed, right? So I am a salaried worker. If I need to take a day off of work, my pay doesn't change because I'm salaried. But for a person who is an hourly worker, if they have to take a day off of work to get on a bus and travel to a healthcare provider, that can impact whether or not they're going to be able to put food on the table or whether or not they're going to be able to pay their rent or whatever the case may be. So the system is really disenfranchising the people who are less resourced as it is. The other area that where you're going to see this is in education. So in some areas, sexual health education is really controversial, but science tells us that in communities where there is abstinence-only health education or no sexual health education at all, you are going to see higher rates of HIV and other STDs. You're also going to see higher rates of unintended pregnancies and whatever the consequences of those unintended pregnancies are. So we are seeing in certain communities where the school system is already taxed. The school system doesn't have a lot of resources, and there is no sexual health education. So it's also there. Not only is there a lack of resources for healthcare, but there's a lack of understanding about how are we contracting STDs and how can we protect ourselves. And it's more than that, right? Like there are people who do not know that you are allowed to say no if you don't want to have sex. There are people who don't know that no means no and yes means yes. And so all of those things, right? I have the privilege of having had that education since fourth grade, but there are a number of people who have never heard those things before. So all of those things change your risk profile when it comes to a number of healthcare issues, specifically HIV, for the purpose of this conversation.
So you're saying the in the school system, because of the funding or whatever the case may be, they lack the teaching of sex education and learning about STDs and other things, and that's why it is higher in those. That's one reason why it is higher in those areas. Is that what you're saying?
Yeah, and so we're actually seeing higher rates of HIV in younger people, and some of that has been attributed to lack of sexual health education. I think I want to just confirm my stats here. I was just looking. The CDC said that the percentage of schools in which students are required to receive instruction on HIV prevention has decreased from 64% in 2000 to 41% in 2014.
Wow.
We're in 2020 now. So where are we now? Where are we now? I don't know.
Yeah, and that's definitely a problem. And that's why we're having these type of discussions so that we can know and be informed about what's going on in the low income areas, because whether we know it or not, it impacts us all.
It does.
One thing that impacts one person, it impacts us all. So we are appreciate that information. How many people in Black and brown communities have been diagnosed with HIV/AIDS?
So that is a little bit more difficult question to answer. I think that what we can say is that there are, hang on a second, I found a statistic earlier on the number of, I want to say that the population of, I'm sorry, because I found a statistic earlier that talked about the percentage of people in each subgroup that had HIV, and I lost it. So I'm just trying to look that up real quick for you.
Okay.
I'm sorry. I thought I wrote it down and then I lost it.
Okay.
All right, so here it is. So and then this is referring to new infection rates, and I think that that's a little bit of the struggle here, is that we're seeing a lot of information about what new infection rates look like, but we're not really seeing as much information about what is underlying. I know I found it because I was like, oh, good. So I can answer this question the way that you want it to be answered.
Yeah, it's fine. I'll tell you what, we'll go to the next one and then give you a little bit more time to find that.
Find what I'm looking for.
So,
Yeah, okay.
Let's go to the next question. How does one's socioeconomic status and the environment that they live in impact impact them, especially those dealing with HIV and AIDS?
So we mentioned already just access to healthcare providers.
Mm-hmm.
And we mentioned already health access to education. There's also access to health care is layered as well. So there is the issue of access in terms of, is there a center or a provider in your area?
Mm-hmm.
Then there is the layer of, is there a provider in your area who can be culturally sensitive to your needs?
Mm-hmm.
Then there is the added layer of, can you find transportation to that person? to those individuals or that center? And then also, do you have insurance? And if you have insurance, do you have enough insurance? Can you afford to take your medications? Or can you afford to pay for your medications? Or do
Yeah.
you have enough insurance to cover the cost of your medications? So at the end of the day, when you're in a poorly resourced community, the barriers are incredibly layered.
Hmm.
Barriers are incredibly layered.
Hmm. And so the environment that you live in definitely has an impact on you in that area. Education level has an impact as well, correct?
Yeah, and then and then we can take it to a completely different plane. So if we're thinking about chronic stress and underlying stress levels associated with feeling unsafe in your community or being over policed in your community,
Mm-hmm.
that also has an adverse effect on your health. We can talk about food deserts and access to
Mm-hmm.
fresh fruits and vegetables, and how that is very difficult in a number of poorly resourced communities, and
Yeah.
how that impacts your health as well. So if you're not eating well, if you're not sleeping well, all of those things impact your immune system, and HIV is attacking your immune system. So it's going to be harder for you to stay healthy with HIV if all of these other factors
Mm-hmm.
are negatively impacting your health.
Yeah, yeah, and that would make sense. I imagine those just a little bit of information I do know about HIV and AIDS, that you got to keep your immune system up as much as possible, and eating healthy is a vital part of that. So if you are not able to get to healthy foods, then that puts you at a big disadvantage when it comes to survival rate.
And I'm going to just put a plug in for sleep because I'm a sleep researcher, and sleep is enormously important and very, very under um, appreciated, under acknowledged for the level of importance that sleep plays in health. And so when you're talking about um, supporting healthy immune function, sleep is a major contributor to that. And when you're thinking about people who are living in lower resourced communities, we are going to be more likely to see people who are working multiple jobs,
Mm-hmm.
who are doing shift work. So maybe they are working days one day and then evenings and then nights another day, and things shift all the time. We are more likely to see communities that have light pollution,
Hmm.
are more likely to see communities that have sound or noise pollution. And all of those things are going to have an adverse effect on your sleep. And if you can't sleep well, your immune system is going to suffer. Your immune function is going to suffer if you can't sleep well too.
Yeah, I can imagine. The Affordable Care Act that was signed by, as I said in the last one, the best president that we had, President Barack Obama. How has that impacted healthcare disparities amongst those with HIV and AIDS?
So the Affordable Care Act was incredibly positive for people living with HIV/AIDS. So there is a program called the Ryan White program that's helpful to an extent, but the Affordable Care Act really did help to bridge some gaps for individuals. One of the biggest things was the clause around pre-existing conditions.
Mm-hmm.
So it made it possible for people living with HIV to get private insurance and get additional insurance, despite having a pre-existing condition. The other thing is it shifted the cutoff, the poverty level cutoff for people to be able to get Medicare. And so that also opened up more opportunities for insurance for people who otherwise were not going to be insured. So the Affordable Care Act was um, phenomenal in helping in helping that.
And if the current administration is successful in removing that pre-existing condition coverage from being from being denied with pre-existing condition, it's going to be a devastating impact on not just everyone else, but definitely those with the HIV and AIDS.
Yeah. It's a really scary thought. It's a really, really scary thought. And so we all need to exercise our right to vote and
Yep.
work hard to prevent that from happening.
Not just for ourselves, but for everyone else.
For
Because
everyone else.
this vote in November is going to impact us majorly. It's going to be a big decision.
Right. So, yeah. There was also prior to the Affordable Care Act, the Affordable Care Act also removed caps. So there was like a lifelong cap previously in some insurances on how much money that they were going to pay out for you. And because it removed that cap, HIV can be incredibly expensive to treat. So removing that cap was also very important for the management of HIV/AIDS.
All right. Yeah, and that's I mean, it did. A lot of people don't know what all the things that the Affordable Care Act done. They didn't read the law. It was a big law, of course, but people don't understand how it has changed to help a lot of us. Whether you are in the lower class or whatever the case may be, middle class like me and yourself, and just it has impacted us all in our healthcare and made it better.
Yeah. So for some people, it really did increase insurance premiums significantly.
Mm-hmm.
And that's true. And I wish that this administration were focusing more on fixing that versus trying to repeal the Affordable Care Act, because there were a lot of very, very important things included in the Affordable Care Act. And I think that it has been politicized in a way that makes it difficult for people to understand what the pros and cons are of this act, right? They coined it Obamacare, and there are people who just have really strong feelings about Obama either way.
Exactly.
And so it does cloud the understanding about what's going on. My understanding, though, is that in Trump's attempts to remove the pre-existing conditions clause, there were a number, and even his supporters, a number of people who fought against that, because it is a very, very important part of the act.
Yeah. So over the past year, funding for research in social determinants and health disparities have been reduced. How can this impact our future healthcare system and those dealing with HIV and AIDS?
So, unfortunately, funding for research across the board has been slashed, which is sad. It is, and it's not just health-related research. Environmental-related research, NASA's budget has been cut. I think there are new proposals even now to slash things even further. So, and ultimately, Trump made a comment, and I don't know if you recall, Trump made a comment that we were going to eradicate HIV by 2030.
Yeah.
A very bold, large statement. And if that were going to be possible, we would need more research funding in order to make that possible, not less. So what these budget cuts means is that less research studies are going to get funded. And the ones that get funded are likely going to have less money than they would otherwise, which means that less quality research is going to get done. And those are the sorts of things that we need in order to advance this cause. Like, if our goal is to eradicate HIV by 2030, we need to be bringing together our biggest minds, our greatest minds around this to make changes. Because like we spoke about, this isn't just a health issue, right? There is a structural issue underlying these problems that needs to be addressed. And if we are in silos and slashing our funding, unable to come together so that we can have a like a multiple pronged approach to dealing with this issue, we're not eradicating anything by 2030.
Mm-hmm. Yeah. Well, that goes with a lot of what the current president said that just didn't make sense and don't back up what he's doing, and just, anyways, don't want to get off on the politics. But
yeah, I will say that it appears to me that Trump has surrounded himself with a lot of really brilliant minds, and that he maybe doesn't take very much of their advice all
oh,
the time.
yeah,
That's the way it just appears to me. I'm not there,
yeah,
but so hopefully that gets better.
yeah. We have two more questions for you before we end our segment for today. Um, how can when it comes to socioeconomic disadvantage in the healthcare system and people living with the HIV and AIDS, how can people play a more active role in addressing that and helping out in that area?
So that's a very layered question, but I would definitely say that we need to start with voting. And I think that as a community, we're really good at voting at our presidential elections. But really, when it comes to the sorts of issues that we're talking about here, we need to be voting at our local elections.
Mm-hmm.
We need to show up and make decisions and have our voices heard about who is going to be managing the money in our community, who is going to be representing us in the Senate and at the House. Those sorts of decisions are really, really important and have an enormous impact. Somebody at some point, like for example, there are having conversations, a lot of conversations about defunding the police, which people have a lot of varying opinions about that, and I have my own. But in essence, if we were to remove or decrease funding from the police, slash their funds, like the slash their funds in the way that research funds are being slashed, right? Like, so
Yeah.
reallocating some of that money elsewhere, we should be involved in the decision making around where those funds are going to go.
Yeah.
And so we want to be working on, we need to have our voices heard in those areas. So having conversations about making public transportation more accessible, increasing job opportunities in urban settings, improving education in urban settings. Those are the reasons why we need to be voting. Those are the reasons why we need to show up. And those are the reasons why we need to be part of these conversations, because at the end of the day, our communities, our Black and Brown communities, are the ones who are suffering the most at the hands of these sorts of policies that are not favoring us.
Yeah, and as you said, the local election is the one that impacts us the most.
Most
The
directly.
election, yes, president, senators, all of that impacts us, yes. But the local elections are day-to-day things that impacts us on a daily basis, and we have to do a better job in our communities in voting in those elections to make real change that is needed for us.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah. Final question. How can we pivot the conversation to strategic, intentional change? And what does change look like to you?
So I think as a health researcher, one of the really important things is being mindful of the way that we just discuss disparities. As I mentioned earlier, there's a tendency to say, well, Black people are just more prone to, and leaving the conversation there. And we are doing ourselves a disservice when we aren't taking the extra step in saying, why is this happening? And how can we resolve the underlying cause?
Mm-hmm.
So being very intentional about stepping away from the idea that our race is determining our health, and really stepping into the understanding that it's an issue of resources and not an issue of color that is putting us where we are right now. And I think that, and another part of pivoting that conversation is voting, like we just said before. You have to be aware of who your representatives are, and you need to have an active role in choosing who those are. And maybe you need to be the one to step up and run for a seat somewhere if there isn't a person who that you trust to have to make decisions that are going to benefit you and your community.
Yeah, yeah. So basically, the most important role you're saying is for us to get involved in the local election. Yes, the general election, but also the local election, and getting the ball rolling, and vote for people that's going to help improve our lifestyle.
Yeah, I think that we start there and we see a trickle effect. We'll see better education. We'll see better jobs, better transportation services, better access to healthcare. And then we will, I think another really big thing is that our communities are over policed, and that's not helpful. It
Hmm.
isn't helpful because we settle our young, particularly our young Black men and our young Black women as well. But we have police in these really poorly resourced communities over policing people, putting them in jail for things that a person in a different an individual in a community that had more resources. So you're in a community that makes 100,000 or 500,000 or $1 million a year. Those individuals are less likely to go to jail for possession of marijuana or as particularly small drug offenses specifically, right? And because they aren't going to jail, they aren't getting saddled with a record, they aren't wasting years of their life behind bars for something that they really shouldn't be a criminal issue, should really be a health issue. Substance use is a health issue, not a criminal issue. And so instead of treating it like a health issue and getting support, we're saddling these young people with felony records and misdemeanors and making it impossible when they come out of jail to, well, not impossible, but very close to making it very, very difficult for them to be able to get jobs or be able to go to school, to get housing, to get government support for things. And so I think that that's another thing, like we really need to rethink our approach to policing and really need to advocate for the end of the war on drugs, because that is probably the biggest detriment to the Black community at this point, in my opinion.
All right. So we're going to go back to the question of how many Black and brown people have been diagnosed with HIV and AIDS. I think you have that information. If you could share that with us.
Yeah, so these numbers are from 2018 data, which is the most recent data that we have. So as of 2018, so in the United States, there are approximately 1.2 million people living with HIV or AIDS right now. So of that 1.2 million, 340,000 of them are white, which leaves the remaining 833,000 or 830 or so thousand are Black or brown individuals, which is, and we're talking about disproportionate and health, when we use terms like disproportionate and health disparities, what we're talking about here is the fact that there are more white people in the United States than Black and brown people in the United States, but
Mm-hmm.
Black and brown people have more HIV than white people. So that's what we mean when we're talking about health disparities.
Okay.
And like we mentioned earlier, the reason for that is grounded in socioeconomics, and socioeconomic differences among races is grounded in racism.
Okay. Okay. Okay.
But so one of the other things that I wanted to mention is that we estimate 1.2 million people living in the United States have HIV. We also estimate that about 1 in 7 of those people don't know that they have HIV.
Oh,
So, so what that means is that approximately 14% of the HIV infected population in the United States is unaware of their status, which increases the risk of transmitting to other people. So if a person with HIV is on taking their medications, taking it regularly, have a suppressed viral load, they are highly unlikely, very, very unlikely to transmit HIV to anyone else. But if you don't know that you have HIV, if you don't have access to healthcare, or for whatever reason have opted against getting tested for HIV, then you don't then your risk of transmitting HIV to other people is incredibly high.
Oh, wow.
So one of the things I mentioned how Trump said that he wanted to eradicate HIV, AIDS by 2030. One of the steps that would be necessary in order to make that happen is that we would have to have everybody who is HIV positive at least be aware, at minimum be aware of their status, so that we can start treating them and getting their virus under control. So right now, what we are seeing is actually a downtrend. We're actually seeing over the last several years, the HIV infection rates have gone down. So overall, they've gone down, and then they've gone down specifically in different, among different groups of people. So heterosexual women, it's gone down by 27% new rates. Heterosexual men, it's gone down by 32%. It's gone down. So for gay and bisexual men, it's mostly stayed stable. It's going down in some age categories, but it's going up in that group that's 25 to 34. So that ultimately just keeps their overall rates at fairly stable. And so the fact that we're having lower HIV infection rates over the course of the last several years could mean one of two things. It could mean that we have even fewer people getting tested and even fewer people aware of their HIV status, or that could mean that we have fewer infections, period. But what we would expect to see if we are going to reach that goal of making everybody who has HIV aware of their HIV status, we would expect to see a huge surge in those numbers over the course of a year or 2 or 3, and then start seeing that taper down. So because again, we want those people who don't know that they have HIV to be aware of their status now.
Okay.
And then the last piece that I wanted to touch on was the issue of PrEP. And I don't know if you've heard of PrEP before. PrEP.
Is that commercial?
So there's a commercial for PrEP, yes. So PrEP is pre-exposure prophylaxis, which means that people who are at high risk for HIV can take a form of HIV medication, like an antiretroviral drug, and they can take that every day. And if they were to come into contact with HIV while they're on this medication, the risk for contracting HIV is there's a 99% decrease in the risk for contracting HIV if you're on PrEP. So now we're talking about health disparities, right? We just had a conversation about how Black and brown people are carrying the greatest burden for HIV and AIDS in the United States. And when it comes to assessing how many of those individuals even know about PrEP, white people know more about PrEP. White people so healthcare providers are having that conversation more frequently with white people. And therefore, white people are more likely to be on PrEP. We have lower PrEP uptake rates. That's what we mean, there's a lower number of people willing to take or who are on PrEP, on this pre-exposure prophylaxis, who are Black and brown than who are white. So those play into the health disparity. So not only are we talking about issues with access, but then there also tends to be some biases in healthcare providers that we can't do anything about, right? We all have our own personal biases, and sometimes that gets in the way of us treating our patients equally across the board. And one of the results of that, there could be there are a lot of other things that play into this as well. But one of the things is, one of the issues that we are seeing is that healthcare providers Black and brown people are less likely to have a conversation with PrEP at all with their healthcare provider than white people.
Okay.
Contributing to some issues. Then also, I think that I said earlier I think I might have said that the Affordable Care Act lowered the poverty threshold for Medicaid care, for Medicare, and it's actually Medicaid. So more people
Okay.
have access to Medicaid now.
Well, Dr. Balthazar, we are definitely grateful for you being with us again on today, and we appreciate the knowledge that you have given us on the podcast, on this podcast. I've been dealing with the HIV and AIDS community, and to our guest, we appreciate you for watching, and you have again been watching another episode of Let's Talk Health.